Hello everyone, I am Dr. Hezil Reema Barboza, Associate Professor, Department of Nursing Foundation, Yenepoya Nursing College. Today, in this session, I am explaining about the topic pressure ulcers. Specific learning objectives of today's session. At the end of this session, the learner will be able to understand the meaning of pressure ulcers, list the risk factors of pressure ulcers, describe the pathogenesis of pressure ulcers, classify pressure ulcers, enlist the factors influencing pressure ulcer formation, list the sites of development of pressure ulcers, explain the prevention of pressure ulcers, enlist the warning signs of pressure ulcers, and explain the assessment of pressure ulcers. Introduction. Pressure ulcers are also termed as pressure sores, decubitus ulcers and bed sores, and these are the terms which are used to describe the impaired skin integrity. It mostly occurs in patients who are unconscious, who are confined to bed, who are in ICU settings, etc. It occurs mainly because of a pressure and which causes a skin damage. The main cause might be a pressure which is for prolonged duration over the skin surface. It occurs especially over the bony prominences, which leads to reduced blood flow to the skin surface and potential tissue damage or ischemia. Let's see the meaning of pressure ulcer. A pressure ulcer is a localized injury to the skin and underlying tissue, which may be to the epidermis, dermis, subcutaneous tissue or fat, muscles, or sometimes to the bones, usually which occurs over a bony prominence, especially back of the head, shoulders, sacral region, lower extremity and the heels, as a result of pressure or pressure in combination with the shear or friction. The risk factors of pressure ulcers. First one, the impaired sensory perception. In patients who are with the impaired sensory perception, we can see commonly the pressure ulcer development. These patients are with the impaired sensory perception, which means they are unable to communicate or verbalize their discomfort of pain, and these are very much prone for risk of development of pressure ulcers. Impaired mobility. Patients who are unable to move the extremities, who are confined to bed, who are in ICU settings with the restriction of mobility. Alteration in the level of consciousness. These patients who are with the alteration of level of consciousness such as unconsciousness, semi-consciousness, and who are in confused state. These are unable to verbalize the discomfort and the pain. Shear and friction, which occurs commonly in patients when we shift the patient from one bed to other bed or when we change the patient position. Moisture of the skin. Here the moisture is very important for healthy skin. Excessive moisture which can lead to development of pressure sores, which can occur because of perspiration, that is excessive sweating, or leakage of fluids, that is especially the fluid from the drainage system, or leakage of urine and fecal matter. Fecal and urinary incontinence. In patients who are with these kind of issues, the risk of development of pressure sores is very common because of excessive moisture in the sacral region. Malnutrition. Healthy nutrition is very important for a healthy skin, and here patients who are weak, malnourished, undernourished are more prone for development of pressure ulcers. Dehydration. In patients who are with the less amount of fluid in the body, who are dehydrated, will be having a dry skin. The skin will be very fragile, which is more prone for risk of development of pressure ulcers. Examples of patients who are at risk for development of pressure ulcers. Here, the older patients or the adults who are elderly and who experience trauma, who are confined to bed, unable to mobilize their extremities, are having a high risk of development of pressure sores. Along with that, patients who are with spinal cord injuries, who are paralyzed, unable to move extremities in a coma stage also will be having a higher risk, and patient with sustained hip fracture where they cannot move or unable to move the extremities. Patients in long-term home or community care settings who are acutely ill are also having a higher risk of development of pressure sores. And patients who are in ICU setting, that is in critical care settings because of their disease condition, along with that the restriction of movement and prolonged days of admission in the ICU can lead to development of pressure sores. Pathogenesis of pressure ulcers. Here the main cause or the major element of pressure ulcer development is a pressure. The three pressure factors which are contributed to the pressure ulcer development. The first comes pressure intensity, pressure duration and tissue tolerance. Let's see the first one, the pressure intensity. What is intensity? So, if the pressure which is applied over a capillary which exceeds the normal capillary pressure and the vessel, that is blood vessel, will be occluded for a prolonged period of time, which causes tissue ischemia or tissue damage. If the patient has reduced sensation and who cannot respond to the discomfort of ischemia, in this patient we can see initial stages tissue damage and which leads to tissue ischemia. Over time tissue becomes more damaged and the area becomes cooler to touch, and this is the initial stage of development of pressure ulcers. Pressure duration. Here both types of pressures which can cause tissue damage, that is low pressure over a prolonged period of time or high intensity pressure over a short period of time, are responsible for the development of pressure ulcers. Tissue tolerance. So, what is tolerance? It is the ability of the tissue to endure pressure which may be depending on the integrity of the tissue and the supporting structures. Here there are different factors which are responsible for the tissue tolerance. The external factors such as shear, friction and the excessive moisture can affect the ability of the skin to tolerate pressure. The other factors, that is the ability of the underlying skin structures, especially the blood vessels, collagen fibers, are also helpful to redistribute the pressure. And systemic factors such as poor nutrition, it may be a malnutrition, undernourishment, etc., increased aging, people who are elderly, hydration status, that is dehydration and low amount of fluid in the body and low blood pressure which affects the tissue tolerance. Let us see about the classification of pressure ulcers. It is classified as stage 1, which is non-blanchable redness, stage 2 partial thickness skin loss, stage 3 full thickness skin loss and stage 4 full thickness tissue loss. Let us see the stage 1, which is also called as non-blanchable redness. So, what happens? It is the initial stage of development of pressure ulcers. Here skin will be intact. It presents with the non-blanchable redness. What is a non-blanchable redness which occurs in this stage? Normally what happens to our skin? When the pressure is applied over the skin surface, it becomes pale or lighter in color, and when the pressure is relieved, it regains its normal color. But in non-blanchable redness, we can see redness over the skin surface even though there is pressure or without pressure. Discoloration of the skin, warmth, edema or pain are the features of non-blanchable redness, that is the stage 1. And stage 1 which indicates people are at high risk of development of pressure ulcers. Second stage is also called as partial thickness skin loss. In this type of skin loss, it presents as a shallow open ulcer. We can see the ulcer in the skin surface, especially in the bony prominences, with a red-pink wound bed without a slough. It may also present as an intact or open or ruptured blister. It may be filled with serum or serosanguinous fluid, that is serum along with the blood. It presents as a shiny or dry shallow ulcer without slough or bruising. Next, stage 3, it is also termed as full thickness skin loss. In this type of full thickness skin loss, subcutaneous fat or tissues may be visible, but bone, tendon and muscles are not exposed. Slough may be present but does not obscure the depth of the tissue loss. Here, slough may be the accumulation of material over the wound bed, and because of this accumulation, it is very difficult to understand the depth of tissue loss. Stage 4, full thickness tissue loss. In full thickness tissue loss, we can see exposure of bone, tendon or muscle, and also subcutaneous fat or tissue. Slough or eschar may be present. Eschar is an accumulation of dead tissues, debris and sometimes bacteria also. The severe stage, that is the unstageable or unclassified stage, sometimes we can see in patients with the full thickness skin loss or tissue loss, where the base of the ulcer is obscured by a slough or the eschar. The figure shows stages of pressure ulcers. The stage 1, where we can see redness or the erythema over the skin surface, that is in the epidermis, and in the stage 2 there is a redness along with the presence of ulcer which involves dermis also. In the stage 3 the ulcer is deeper and we can see involvement of epidermis, dermis and underneath structures. And the stage 4 where we can see shallow deep ulcers where there is a exposure of subcutaneous fat, tissue, soft tissues and bone. Factors influencing pressure ulcer formation. First is the nutrition. Healthy nutrition and balanced diet is very much important for a healthy skin. People who are malnourished, undernourished and weak are more prone for development of pressure ulcers. Tissue perfusion. Tissue perfusion is very important to supply blood to the skin surface and which improves the skin health. Infection. Infection conditions, that is infection of skin and other conditions which can worsen the condition. It requires appropriate treatment to minimize the rate of complications. Age. Age, especially elderly, are more prone for development of pressure ulcers. Sensory impairment. Sensory impairment which includes patients who are having impairment in sensory function, who are unconscious, paralyzed and unable to express their difficulty of discomfort and pain. Pressure ulcer sites. The most common pressure ulcer areas are the bony prominences, which includes the back of the head or the ears, shoulders, elbows, lower back and buttock, hips, inner knees, legs and the heels. And the figure shows the different areas of pressure ulcers in different position. Warning signs of pressure sores, which includes initially the skin become red. It is a non-blanchable redness or erythema, itching, pain at the site, dry or rough skin, swelling and warmth. Prevention of pressure ulcers. It requires frequent positioning, especially in those patients who are unconscious, confined to bed with limited mobility, who require frequent position change to prevent the complications. Second comes therapeutic beds and mattresses. So use of these beds and mattresses will be relieving the pressure over the bony prominences the use of airbed, water mattress are used in patients who are bedridden. Maintain good skin hygiene. The skin must be kept very clean, dry, and also provide back care to the patients who are confined to bed. Use pressure relieving devices such as air cushion over the sacral region so that we can minimize the rate of complications and development of pressure ulcers. Ensure adequate nutrition, provide a healthy balanced diet for the healthy skin, and topical skincare applications can be used to keep the skin moist and to provide a healthy skin. Incontinence management in patients who are with the fecal and urinary incontinence, appropriate management for these issues can be considered to prevent the bed sores. Assessment of pressure ulcers. Here the patients are assessed for the development of pressure ulcers by using specific scales. First one is the Braden scale, which is very commonly used assessment tool for the development of pressure ulcers. The components of this tool, which include sensory perception, moisture, activity, mobility, nutrition, friction, and shear. The scores are interpreted as low risk when the score is between 19 to 23, mild risk when the score is between 15 to 18, moderate the score between 13 to 14, and high risk the score between 10 to 12, and severe risk of development of pressure ulcer when the score is less than 9. Another tool that is called as Norton scale, which is a rating scale, is also used in the assessment of pressure ulcers, which has several components, which includes physical condition, mental condition, activity, mobility, and incontinence. The scores are interpreted as less than 18 low risk, between 18 and 14 medium risk, between 14 and 10 high risk, and less than 10 is very high risk for development of pressure ulcers. Wound management. Assess the wound frequently, assess the stage, size, and characteristics of pressure ulcers, monitor the signs for infections, and if there is an infection, appropriate antibiotics or other methods are used. Wound care. Wound care is very important to minimize the risk of infection. Provide adequate dressing, change the dressing whenever it is contaminated or when there is a leakage of fluid occurs, especially drainage, leakage of urine and fecal matter. Pain management. Appropriate pain management techniques can be used to provide comfort to the patient, and at last monitoring and evaluation of the wound is required for the recovery of the patient. Conclusion. Decubitus ulcers are a significant health concerns, especially for individuals who are with limited mobility, who are unconscious, who are in ICU settings and even in the home care settings. Prevention is crucial. Effective management for the pressure ulcers. We can prevent pressure ulcers with the appropriate back care, frequent changing of positions and other preventive measures, and we can minimize the risk of development of complications in these patients. Thank you.